Hey everyone, today I'm going to talk a few minutes about mirror therapy. Now this can be a very powerful technique to try to reduce pain symptoms that someone's having, even to help to try to return function of movement, especially of a hand. And so I've been using mirror therapy for, I don't know, close to 20 years in my practice, and I think it's very effective, and it can be a nice adjunct to other techniques and things that you're doing. Especially if the patient, let's say it's a painful situation, complex regional pain syndrome or something like that, or just a painful hand or fingers. I've had patients who've done it with the shoulder, the arm, or even the leg. Of course, the mirrors need to be bigger for those areas, but it can be very, very effective. And so essentially what you're going to do is you're going to set up a mirror, and you're going to put your affected hand or the side that's having pain into inside or behind the mirror, and then the other hand is going to be in front. So the reflection that you're seeing is actually the non-injured or the unaffected hand or extremity is going to be the one that you're moving on the outside, that you see the reflection in the mirror. So what this is doing is it's tricking our brain into thinking that we're going through some of these normal movement patterns with decreased pain. So we're kind of desensitizing the brain a little bit. Still going to therapy, but you can use this to complement that at home and to go through some of these movements and exercises at home. And a lot of times, especially with pain, a lot of that deals with trying to basically convince the brain that there's nothing going on, or the severity that the brain is perceiving of the pain level is not there. If you broke your arm or you broke your leg, and the bone is, sticking out, right? Like, that's a 10 out of 10 pain. 2 or 3 days later, you see the same person, right? And they're in a cast where maybe they had surgery, maybe they didn't have surgery. And you ask them, okay, well, how's your pain? What's your pain level? And like, oh, it's a 3 or 4. Is it a 10 out of 10? Well, no. Well, why isn't it a 10 out of 10? Because technically it's still broken. It's not healed. The bone is not, ossified and closed off. It's still broken. The reason your pain level is not as much is because the brain perceives less threat. And so it's a perception of threat. And so that when you're using the mirror therapy, some of that is kind of tricking the brain into some of this movement. Maybe the affected extremity or the affected hand isn't going into all the wrist extension, but the other side is going, the one that you're seeing is going through all this wrist extension. But in your mind, it looks like you're going through this movement, and it's not hurting as bad, right? So it's just a really interesting way that you can go through this treatment, and it's very, very effective in a lot of cases. I hope this video helped to explain a little bit about using mirrors for mirror therapy. Be sure to hit that like and subscribe button, and thanks so much.